Joining us now in our newsroom, we have Dr. Sean Granis. He is the VP of Data and Analytics at the Regenstrief Institute. Dr. Granis, it's great to see you.
Good to see you too as well.
Okay. So we have a couple things going on. The COVID-19 vaccine was just given its first doses to some candidates in the UK. Today, there are reports that there have been side effects, specifically in 2 healthcare workers. These individuals both use EpiPens, but they experienced anaphylactoid reaction, which can be really dangerous. So this leads us to some questions about this vaccine. So first question for you is, how did we miss this in the clinical trial? How did we miss that this could have been a side effect of the Pfizer vaccine?
Well, I'm not sure that we missed it. And let's talk a little bit about how the studies are done. So this trial has over 44,000 people in it. They looked for these adverse events. There were allergic reactions, not anaphylactic reactions or anaphylactoid reactions like we've seen here, but in 0.6% of the people who got the vaccine, there were allergic reactions. In 0.5% of the placebo, there were allergic reactions reported. So that's a 0.1% increase among the vaccines. So it's a small number, and there's a lot of uncertainty around that number. We always know that there are allergies associated with vaccines. They're typically very mild and very rare. And in fact, the fact that these 2 people carry EpiPens on a regular basis tells you that they have a history of severe or significant risk of severe anaphylactic response. There's always a caution on vaccines that if you are allergic to any of the ingredients in the vaccine, or if you have a prior history of severe anaphylactic reactions, you should be significantly cautioned against taking the vaccine. I don't know that we have all the details on why or how these individuals were cleared for the vaccine, but what I think is important for people to realize is very often we hear about allergic reactions, and in healthcare, we see a lot of folks who say, you know what, I have a food allergy, so I'm not going to take the vaccine. And the reality is almost everybody has some allergy to something, typically very mild and not a big problem, doesn't affect your life. The fact that you might have a food allergy does not mean that you shouldn't take the vaccine. But we always caution that anybody who has severe prior allergic reactions, like apparently these 2 people did, there needs to be a lot of caution around that. And so we will continue to advise people that if you have had a history of severe allergic reactions, by severe meaning that you have to carry around an EpiPen to treat severe reactions, or you've been hospitalized or had to go to the emergency department because of that, those are reasons to really be concerned. Otherwise, mild reaction's not a big deal. And I guarantee you that there are always cautions around these vaccines as people contemplate taking them.
Mm-hmm. And considering, I mean, there were 2 individuals that just happened to have a allergic reaction, and it just happened to be that they both carry EpiPens. I mean, could this be a coincidence that they both had this sort of reaction, or are we thinking that maybe, I mean, because the numbers are so big, it's just, could something else have happened that was just coincidental, or can we directly relate this back to the vaccine?
Sure. So it sounds like it was related to the vaccine, but we're sort of in the speculation space here because, you know, we all can read the same news reports that have come out today, but not a lot of more details come out. So I don't know all of the details around this, but clearly what I do understand is that they were individuals who had to carry EpiPens, which tells you something significant about them. We do, when vaccines are rolled out, we do often uncover rare, smaller reactions that might not have been picked up in the initial trial. In fact, the United States has something called the Vaccine Adverse Event Reporting System that's been in place for years to exactly capture these issues. And so I think that the COVID-19 vaccines will be the most closely monitored vaccine deployment in human history. So I think we're going to be watching this one closely. And I think we need to continue watching. But again, the typical precautions are in place here. If you have a significant history of anaphylactic reaction, or if you have any allergy to the ingredients in the vaccine, you should be talking to your healthcare provider about your eligibility for that.
Mm-hmm. So this has been true for vaccines in the past. This isn't something new specific to COVID-19, that someone who has an allergy could had some sort of adverse or mild reaction to the vaccine.
Right.
Is what you're saying.
The known medical knowledge is in play here. We do know that people who have increased risk for anaphylactic reactions are a very specific type of response, mm-hmm. And they impact a very small percentage of the people, and the people who have been impacted know they've been impacted because they've experienced some significant clinical outcome or event that requires them to carry that pen and to be aware and alert. So again, so we're always cautioned. We tell people that you could develop a mild reaction to a vaccine, but generally for the vast majority of people, so they enrolled 44,000 people in the study, 42,000 people got the second vaccine. So that's, that goes to safety and the ability for this to be tolerated by a very large population. Mm-hmm. To be clear though, in the research study, and I think this is important, those people with a prior history of anaphylactic response or any known allergies to the ingredients in the vaccine were excluded from the trial. So if they're excluded from the trial, you probably should be excluded from being considered to take this vaccine. Okay. So those are some of the guidances that and again, that guidance is not different or unique to the COVID vaccine.
Right. So that raises a really interesting point, because we're slated to, given FDA approval, if this rolls out to the U.S. After the FDA convenes, and we are expected to distribute millions of doses. This has been tested on 43,000 people, this Pfizer vaccine, but it will be essentially going to millions and billions of people around the world. The way in which this is going to be distributed, these organizations, the CDC and the scientific organizations are saying that, of course, we'll have our front care workers first vaccinated, followed by our vulnerable populations, where our vulnerable populations carry many things, many sort of comorbidities and things that could potentially have a reaction there. So it raises the question, if there's someone who has an allergy and has an adverse reaction, well, we know what to do with that allergy. We have our, let's say in this instance, we have our EpiPen, we have our EpiPen, and we know what we can do to handle our allergy when we experience some sort of adverse effect. And luckily these people knew right away what was happening when they took the vaccine or the effects afterwards. But what are your thoughts on the way in which this is going to be distributed? Because as you had mentioned, people with this type of allergy were not included in the study. They might have been dismissed because of this pre-existing allergy to the vaccine. But what about people who have diabetes, or people who have hypertension, or people who have certain cancers? What are your thoughts about that? This is just sort of raising a larger issue on how this is now going to be distributed.
Sure. And, these questions apply to any vaccine trial that occurs in any new vaccine that's developed. We look very closely, the patients, the selection process for the types of patients that go into trial are chosen in an effort to represent as broad a swath of the population as possible. So the trials are designed to try to, as much as possible, detect even infrequent outcomes. But it's not possible to capture everything. But what we do know about the safety of this vaccine is, regardless of the patient's age, race, gender, we didn't see any unusual adverse side effects. And again, I think it's going to be very important, because every person's health history, every person's health circumstance is different. It's going to be important to have a conversation, if you have any concerns about your eligibility for the vaccine, to talk with your healthcare provider and make that determination. Generally, for the vast majority of the population, this vaccine is safe, will be safe, and we'll continue to monitor its effectiveness.
Mm-hmm. And last 30 seconds, what else would you, anything else you'd like to tell us? People of Indiana are Hoosiers about this vaccine, and what to anticipate, expect. Should we be hopeful?
Oh, I do think we should be hopeful. We've been waiting for vaccines for some time. the study data on these vaccines are out there. They have passed and are under review for their safety and efficacy. All of the data that I've seen suggests that they're a reasonable safety profile. In fact, some investigators, some individuals who have seen the full data have said, I give this vaccine an A+ for safety. So I think we can be hopeful and confident in the process that the vaccines are going through to be tested and validated, as all vaccines before them have been.